Now, the first big risk factor for breast cancer in general is being female, and there's not much you can do about that. And then the second biggest risk is getting older. The average age of diagnosis is 65, and only 1% of women are diagnosed before the age of 30. So basically, the first two risk factors are things you can't change, and that doesn't leave people feeling very empowered. So you got to look into the things that you can change. And in order to do that, we have to look at relative risk. In other words, if somebody doesn't do a certain thing, what kind of risk are we talking about as opposed to if they do those things? So to get kind of a baseline feel for that, I think we can look at the genetics component of it. You can say, if somebody were to have a mother or a sister, emphasis on or, then they have approximately a 2 times relative risk of contracting breast cancer over the course of their life. If you make that or into an and you make it a mother and a sister, that relative risk jumps and goes somewhere in the neighborhood of 3 to 14 times the baseline risk. And that depends mostly on how many sisters are in that and trail. Interestingly, if you make it where they both had the cancers before the age of 40, that relative risk skyrockets. It becomes 39 times. And those are the cancer families that you're used to talking about, where those genetics really come from.